Why does alcohol cause headaches and hangover syndrome? Alcohol, which entered human life with the beginning of the agricultural revolution and has been consumed for various purposes for thousands of years, causes many people to experience various complaints such as headache, nausea, weakness, depressive mood, muscle and joint pain the next day. Of course, not every person who drinks alcohol has these complaints. Complaints that may occur the next day vary depending on the amount of alcohol consumed and the speed of drinking. Hangover syndrome varies in everyone depending on the person's age, gender, health status, lifestyle, medications used and genetic characteristics. If we look at the issue in more detail, we can say the following. We need to state this from the very beginning. Essentially, being tipsy or drunk is a sign of poisoning. However, since these symptoms of poisoning are enjoyable and do not kill the person, it has not been possible to prevent people from knowingly poisoning themselves with alcohol for centuries. After all, methanol, the cousin of ethyl alcohol, also has narcotic effects such as giving pleasure and intoxication. But methanol poisoning doesn't just cause intoxication. At the same time, it causes blindness, paralysis and death. Ethyl alcohol is a narcotic substance preferred by people because it does not cause death or serious side effects like its cousin methanol. Alcohol hangover syndrome is an annoying side effect of excessive alcohol consumption. Although very common, the exact etiology of hangover remains unclear. In this video, we will examine why this annoying situation occurs. Alcohol causes this problem through several mechanisms. Understanding these mechanisms may facilitate the development of effective preventive and therapeutic interventions. We can summarize why alcohol causes hangover syndrome as follows. First reason: conversion of alcohol into acetaldehyde by the liver. Metabolism is an important determinant in the emergence of hangover symptoms. Ethanol, the primary component of alcoholic beverages, is metabolized predominantly in the liver by alcohol dehydrogenase and cytochrome P450 enzymes. Acetaldehyde, a toxic metabolite that contributes to hangover symptoms, causes these undesirable side effects. Acetaldehyde accumulation. It causes cellular damage and functional disorders by triggering oxidative stress, inflammation and metabolic disorders. In fact, alcohol itself is not such a toxic substance. However, when alcohol is converted into acetaldehyde by the liver, a troublesome situation arises for the body. Because acetaldehyde is a much more harmful and toxic metabolite than alcohol. In addition, chronic exposure to acetaldehyde increases the risk of cancer in some tissues and organs. Therefore, depending on the amount of alcohol consumed and the rate of drinking, acetaldehyde formation varies throughout the body. Some people cannot remove acetaldehyde from their bodies quickly and effectively enough due to genetic and physiological reasons. These people have to be much more conscious about alcohol consumption. Second reason: alcohol causes fluid and mineral loss. Another problem caused by alcohol is that it causes dehydration. Following alcohol consumption, there is an increase in fluid and mineral loss from the body. The diuretic effect of alcohol causes increased urine production, leading to dehydration and electrolyte imbalances. Depletion of essential electrolytes such as potassium and magnesium disrupts cellular balance. This exacerbates hangover symptoms such as fatigue, muscle weakness and headaches. Third reason: alcohol has a negative effect on the immune system. As it is known, alcohol has toxic effects on the immune system. Alcohol consumption endangers the function of the immune system by having regulatory effects on the immune system. High levels of cytokines and immune system activation contribute to inflammation, worsening hangover symptoms and weakening the body's ability to heal. Fourth reason: alcohol disrupts the neurochemical balance. Alcohol and its toxic metabolite acetaldehyde have negative effects on brain chemistry. Neurotransmitter imbalances caused by alcohol and its metabolite acetaldehyde play a crucial role in the development of a hangover. Impairment of neurotransmitter systems, particularly gamma-aminobutyric acid, glutamate, and serotonin, contributes to mood disorders, cognitive deficits, and headaches often experienced during a hangover. Reason 5. Individual variability and genetic predisposition. Variability in individual susceptibility to hangovers suggests a genetic predisposition. Genetic polymorphisms in enzymes involved in alcohol metabolism, neurotransmitter receptors, and cytokine genes may contribute to different hangover susceptibility among individuals. In conclusion, we can summarize the issue as follows. Alcohol-induced hangover syndrome is a complex acute illness with multifactorial etiology that includes metabolic, neurochemical, immune and genetic factors. An integrative approach that considers these mechanisms is crucial for the development of effective treatment methods to alleviate and prevent hangover symptoms. Alleviating the annoying effects of alcohol-induced hangover is an important goal not only for human health, but also for work efficiency, public order and traffic safety. Therefore, until the scientific world develops a much safer alternative to alcohol or a treatment method that will completely prevent the unwanted side effects of alcohol, avoiding excessive alcohol consumption and fast drinking is the most effective preventive measure that can be taken against a hangover.